Good?
Yeah.
Okay. Hello, everybody, and welcome to the second episode of WHAMcast, a podcast by the Women's Health Awareness Movement, aka WHAM, where we shed light on a range of important health topics for women. My name is Taylor Morgenstein, and I'm a fourth-year medical student representing WHAM. Today, we're joined by Dr. Annie Leung, gynecologic oncologist and innovative researcher at the McGill University Healthcare Center. Dr. Leung brings a wealth of experience in all gynecologic malignancies with a particular focus on cervical cancer. We're excited to have her here with us today to explore how we can raise awareness about cervical cancer, including prevention, recognizing its unique symptoms, and addressing disparities that affect healthcare. Just before we begin, we want to acknowledge the importance of using language that is inclusive and respectful when discussing gynecologic cancer. The information shared may apply to anyone with a cervix, including cisgender women, transgender, non-binary, intersex people, or anyone assigned female at birth. We acknowledge that gender and sex are distinct, and we encourage listeners, especially healthcare providers, to approach conversations about gender identity with openness and sensitivity, tailoring each person's care to their unique needs. Now let's begin with the podcast. So, Dr. Leung, to start, what motivated you to specialize in gynecologic oncology, and how did your research interest develop?
Yeah, great question. So when I was a medical student, I had the opportunity to rotate on obstetrics and gynecology and really fell in love with the patient population that looks after women with cancer. There is such a wide range of ages, background, and unfortunately cancer doesn't discriminate, and I felt the intense need to help them, and I love the surgical procedures associated with it, and it's a longitudinal relationship that I have with the patients, and you really get to know them and their families. So that's what really interests me. For cervical cancer, I had the opportunity to go abroad to Uganda as a medical student, and then again as an obstetrics and gynecology resident to Brazil, and really see the need for promoting screening, promoting vaccination. We have the tools at our hands, but those who need it most are not accessing it for a multitude of reasons, and so that's what motivates my work.
Okay, I love it. And so you've mentioned cervical cancer a few times now, but just to break it down, generally, what is cervical cancer? Who does it affect? And what are the risk factors for it?
Yeah, so cervical cancer comes majority from the infection with human papillomavirus. Human papillomavirus is very common. About 8 in 10 women would have it in their lifetime, and one of our jobs is to destigmatize it. I think one of the initiatives we have done with school-based vaccination at a young age and really saying it's a cancer prevention vaccine is very important. Now, with the infection of the virus, over the years, it can cause the cells on the cervix to change, and majority of the time, your body's own immune system is going to clear those cells, clear the virus, and it doesn't cause issues. You mentioned risk factors. There are some things that make someone more prone to having the virus go beyond and develop from abnormal cells to cancer cells. Things such as smoking. If you have a health conditions that make your immune system weaker, such as HIV, or if you had an organ transplant, for example. Other things like multiple sexual partners, and also other vaginal and cervical infections.
Okay. And so we've mentioned prevention a little bit. Within the world of HPV, prevention is largely constructed around vaccination and screening. Could you provide us with an overview of how this works in the Canadian healthcare system? And we can start with vaccination.
Yeah, so with vaccination, it's offered for students in school between the ages of 9 and 12. And at the moment, 2 doses are recommended. Now, there are people who miss that window for vaccination in school, and for those people, I highly recommend they talk to their family doctors, or if they do not have one, even approach a walk-in clinic or CLSC and see if they may be eligible, because there are some situations where even if you are older than 12 years old, we would recommend the vaccine to decrease your risk of cervical cancer. And I also want to take this opportunity to stress that human papillomavirus vaccination is not just preventing cervical cancer. We know that it can decrease the rates of head and neck cancers, anal cancer, and vulvar cancer, and many other cancers that can affect other organs. And because of that, that's why we also recommend it to both boys and girls.
Okay, I was going to ask, so over the years, this kind of like screening programs have changed and now are more inclusive to really target everybody.
Yes, we have seen that it is really important to be very inclusive and really not, target just to say that this is a vaccine for girls, but it's a vaccine for all. And we have proof that by vaccinating the general population, you can eliminate cervical cancer, which is a huge idea. Like to say that within our lifetime, Taylor, cervical cancer is going to be eliminated. We're not going to be teaching it in medical school. It's amazing. One example to give you is Australia. They have promoted vaccination, and they are going to be one of the first countries to say that their rates of cervical cancer is so low that it's not going to be a cancer that they need to screen for.
Wow, okay. What do you think was the main driving factor in Australia being so successful with this?
I think it takes a lot of programmatic and policy work on many fronts. It's not something that doctors alone can help with. It takes the government, it takes patient advocacy, and to really stress the importance of vaccinating everyone and also vaccinating early and destigmatizing to say that this is related to sex. It's about cancer prevention. That's what we're here for.
Of course. So despite its proven effectiveness, some people hesitate to get vaccinated. What are some of the main reasons for this hesitation, and how can we better address those concerns in a healthcare setting?
Yeah, I think one of the main reasons I've heard is that vaccination with the HPV vaccine, because there is this notion that HPV is related to sex, and it is, that it's going to promote sexual activity among young people. But understanding that by vaccinating them early, regardless of when they decide to engage in sexual activities later on in their lifetime, that is the best time to prevent them from actually getting the virus. You want to vaccinate them before. Then that's why we promote it at such a young age, and we want to include it in the childhood and adolescent vaccination program, also because their immune system is built a little bit differently, and it has a greater impact, and they can have a more enduring protection from contracting the virus later on. So I think really promoting the education that this is about. Yeah, you're right. This is about promoting prevention of cancer and destigmatizing the sexual association would really help promote and increase the vaccination rates.
Yeah, and I think that speaks to generally how education is power, especially with young people. We tend to promote sexual education so people are informed and not making uninformed decisions. So
knowledge is power.
Exactly. And apart from vaccination, what does prevention look like? What are some other preventive strategies that we talk about with patients?
Yeah, so I think the importance of coming for screening tests when it's age appropriate. You probably have heard that something called the pap smear has been around for many years now. And this is when a woman comes to a family doctor, gynecologist, a nurse, and they undergo a pelvic exam where they look at the cervix and take some cells from the cervix to analyze underneath the microscope, and we can tell and see if there are cells that may be concerning, but many times it's more prevention, and it just really allows us to say, hey, maybe we should follow you a little bit more closely. The chances of having cervical cancer after screening is extremely low. When we do see cervical cancer, it's unfortunately when people have not had the chance to access a doctor to get the pap smear. Now, having said that, I have been able to see the very exciting development of some of the changes in screening that has been happening over the last couple of years. There's something called the HPV test, where instead of looking for abnormal cells, we can actually look for the virus itself. So by doing that, we can catch the disease a little bit earlier. And the main driver that is going to really change our cervical cancer screening paradigm is HPV testing can actually be done at home with a swab that a patient can swab themselves gently in the vagina, send it off for testing, and get the results, and they can be told if they need follow-up from there. That decreases a lot of barriers for patients who are uncomfortable with the exam, or they are worried about having to make the trip to see a doctor.
So self-testing. So classically, we thought about pap tests as being the way to test for cervical cancer, and now we're moving towards a different paradigm.
Yeah, so self-testing allows a person to take a swab, gently insert in the vagina, collect cells and any of the fluid, send it to the laboratory through a mail, for example, or drop it off in a local clinic and get the results. And it decreases a lot of the historical barriers, such as I need to have a painful exam by a doctor, and finding a doctor is a challenge. And if you think about how fast Canada is, and for example, people who live up in the northern communities who cannot easily travel to, let's say, center of Montreal for a test, if they can do it in the comfort of their own home, it decreases the travel barrier as well. So a lot of the previous barriers are now eliminated, and I'm happy to report that British Columbia is one of the provinces that have really initiated the path to seeing how sampling can change our screening programs, and I am very excited to see how that spreads across Canada.
Of course, yeah. I mean, I think that sounds like a great recipe for eliminating all these barriers that you've discussed. Do you think we'll be seeing this in Quebec anytime soon?
I hope so. The first step that we are working towards in Quebec is to roll out the HPV test itself. As you can imagine, it requires changes in the laboratory, patient and clinician education, as we mentioned before. So that is the first step I would like to see in the next several years, to be able to also have, once we have that infrastructure of the self-testing, the Quebec government in NEST organization, which looks at how we design screening programs, have incorporated and mentioned self-testing in their guidelines. So it's very much on our minds, and it's a question of getting the infrastructure and the education and outreach, which is why we're here today.
Of course, yeah. So exciting changes coming to prevention for cervical cancer. All right. And so next we'd like to talk about some more topics related to screening. So HPV testing can sometimes be a sensitive topic for women, especially if they feel embarrassed or worried about the results. How can we make patients feel more comfortable when discussing HPV testing and its importance, and how do we encourage them to do so?
I talk about how common it is and to normalize it. I gave the statistics that 8 out of 10 women in their lifetime would have HPV, and that it's not something to be embarrassed about. Many people have it, we just don't talk about it. And by going for testing, you're really taking care of yourself and that is the most important. This is your health, and we're here to help you with that. And to know that it's not a test that, you know, once you have the results, nothing is going to happen. No, like we have very effective methods to help prevent any abnormal testing or abnormal pap smear from developing into cancer, and to let them know that these interventions are very effective and we have a chance to intervene early on. So I hope that encourages them to take care of themselves and to know that this is part of, you know, looking after their own health.
Mm-hmm. Yeah, of course. And on the realm of, you know, knowledge is power, and so patients know, two main questions. So if someone were to have cervical cancer and it hadn't been caught on screening yet, what are some signs and symptoms that the patient might look out for?
Yeah, very good question. So abnormal bleeding, now that can mean very different things for each woman, but I truly believe that every person knows their body best. So if something is not in line with what your normal period is, for example, and you're bleeding after sexual intercourse or inserting a tampon, or there's new pain and that wasn't there before, those are some of the things that you should really watch out for, and to seek a healthcare exam and take it from there.
Okay. And, you know, often I think most people generally understand the idea of a pap test, but what happens beyond the pap test? What are the next steps beyond screening?
Yeah, so after a pap test, if it's a normal result, we usually recommend just a routine follow-up in about 3 years' time. Now, if there's any abnormal cells, the first thing I say is don't panic, because a lot of these cells, as I mentioned, if you're otherwise a healthy person, these cells your body can take care of, and they go away by themselves. But we have to do our due diligence, and what we would then suggest is that you be referred to a gynecologist and undergo a more detailed exam called a colposcopy. So what is a colposcopy? Colposcopy is similar to how we take a pap test, where we insert a speculum gently and we take a look at the cervix, actually see if there's any redness, any masses that we can see. And the colposcope is essentially a camera with a magnifying glass that lets us see the cervix in higher magnification so that we can really see if there's abnormal cells. At that point, this is something that I do in my clinic and it's available but in other gynecology clinics, is we take a small biopsy and send it to the pathologist, and they can tell us if, the pap smear was just picking up some reactive and irritation changes, not to worry, just come back for follow-up. Or if they see that there are normal cells, this is when I would say, okay, we can bring you back and we can remove those cells with a small excisional procedure. So that's why I was saying that there are very effective interventions, and that's what a patient can expect at a colposcopy visit.
Okay, interesting. So there's many steps, in this general, paradigm and scheme of cervical cancer. Okay. And we spoke before about access to care and disparities to care. We know that access is only part of the picture. What do we know about disparities in cervical cancer screening and then outcomes, such as differences in stage of diagnosis or survival, and especially those among marginalized communities?
Yeah, great question. So disparity is, I think, a big challenge that we are trying to overcome in the elimination of cervical cancer. Now, you can think about disparity in different historical groups that historically have not been able to access screening for a multitude of reasons. A few examples that come to mind is one, for example, indigenous populations. They have been historically underscreened. Some of the reasons are there's a language barrier. It's we're not transferring the knowledge they need appropriately. Travel is a challenge for them to access a actual clinician who can do the exam for them. And we also always have to be mindful of the historical trauma and mistrust in the healthcare system. I had a patient that says, "What do you mean you are testing for HPV DNA? Is this something related to my genetics and going back to my family?" So there's a lot of trust and relationship building that needs to happen. Another population that has historically been underscreened is the LGBTQ population. You can imagine when you appear outwardly maybe more masculine, to be sitting in a gynecology clinic can be very uncomfortable and awkward, and to have to explain yourself can be challenging as well. So we need to think of how we can design clinic environments that may be more inclusive and more comfortable for LGBTQ community. And another underscreened population is immigrant population. We are very fortunate in Montreal that it's extremely multicultural. We welcome people from all walks of life, but to understand that they have language barriers and barriers to access healthcare in general. So there's still a lot of work to be done despite the fact that we have the tools and technology at our hands.
Okay. Yeah, it's important to think about, it's not just a pap test that someone is walking into their family doctor. So yeah, there's really more steps and, more barriers that people might face in this process. Okay. And in terms of general knowledge about HPV, there's many myths that persist. And particularly this regards transmission and health risks and, sexual involvement, as we discussed. What are some of the most common misconceptions you encounter, and how do you approach these with your patients, and how do you clear up these misunderstandings?
So the one of the misconceptions is that once I have the virus, I'll definitely have cervical cancer. And that is not true. Majority of the time, the body's immune system clears it. We do, transmit it through sexual activities, and it can be passed on to different partners. But at the core of it, with an intact immune system and good screening, we can intervene. So there is something that can be done. We talked about the myth that talking about HPV or giving the vaccine to young boys and girls would promote promiscuity. Truly, we actually studied this, and we found that no, that is not true, and actually giving them knowledge about how virus causes cancer helps young people be more empowered to take care of themselves and to make decisions about their health for themselves.
Okay. Yeah, I think those are two very general common myths that it's nice to receive some clarification on. Is there a patient story or experience that stands out to you, one that highlights the importance of prevention, early detection, or the challenges that some patients might face?
Yeah, there is one. There was a young woman who unfortunately had presented to multiple doctors and emergency departments for abnormal bleeding and pain. I talked about those two being common symptoms of cervical cancer. And she also reported weight loss. And unfortunately, the healthcare system failed her in that because she had a history of eating disorder. Many of the healthcare providers she encountered had attributed her abnormal bleeding to irregular cycles due to eating disorder, and said that, just fix your eating disorder. And when I had a chance to see her, she had cervical cancer that was stage 3, and that is devastating for a young person who might have hopes about what she would want in her future. maybe she wants family, maybe she wants kids. All those things become, uncertain with the cervical cancer diagnosis. And she was not offered a pap test. Now, fortunately, she had undergone treatment, and she needed chemotherapy and radiation, and she's doing well now. But it sticks with me that as a healthcare provider, it's important that I, think about this and not, brush it under the carpet, so to speak, and to really listen to patients when they talk about their symptoms. And it goes back to the concept that every patient know their body best.
Yeah, of course. Yeah, I think that's a helpful reminder also for health providers to not anchor their diagnosis, and to always keep in mind these key health issues that do affect women specifically that we have to be thinking about. So that's a helpful patient story. We've touched on it a little bit, but what are some developments in cervical cancer prevention or treatment that you're most hopeful about?
Yeah, so we've talked about HPV testing and the self-testing at home, which is very exciting. And in actual cervical cancer treatment, we've talked about chemotherapy as the traditional treatment, but over the last several years, we have learned a lot more about the immune system and how to use it to our advantage for cancer treatment. So I've been able to offer what we call immune therapies to cancer patients, and we know that there's interaction between cervical cancer cells and the immune system. And there's immune therapy where it basically teaches the immune cells, this is cervical cancer tumor, go attack it specifically, instead of a chemotherapy may attack cells throughout the body. So that is a very exciting thing to be able to offer patients. And then talk about more global initiatives. I'm very excited about the work that is being done by larger organizations to train people in colposcopy, in cervical cancer treatments like surgery and chemotherapy and radiation, and also being able to reach the historically under screened population. I mentioned that when I was a resident, I had the chance to go to Brazil, and a tour bus with a colposcopy clinic on board, and they were literally driving through the Amazon to look for people who would want to have the cervical cancer screening. And how they attracted people to come was they had a local star that they pasted the name and the picture on the side of the bus. So I don't know what the the equivalent here, but like if you can imagine, like for example, Taylor Swift coming down the St. Catherine Boulevard and saying, "Come on, let's get you cervical cancer screening," people might come. So little things that are not just about the medicine or the basic science. As much as I love those aspects and they're so important, I think we're really at a time where we can do so much by just reaching out to the people in the community.
Yeah, of course. That reminds me of there's different organizations in Montreal that will hold like free HPV screening clinics. And a lot of the times I've spoken to the women who come, and I'll ask them, how did you hear about coming? And they'll say, oh, it was shared on WhatsApp, or it was shared in this community. And I think it really highlights how people come in masses to these screening events. People want to get screened, but sometimes don't have the opportunity, and you really have to reach people where they can best be reached. And maybe that's a WhatsApp group chat, but if it reaches the right people, then it's important.
I think it's hugely underutilized, like podcasts like this, or like things that we post on social media to really encourage people to improve their access, to improve their knowledge on things, and to advocate for themselves. I didn't have podcasts or like Facebook when I was going through medical school. So I think there's so many opportunities, as challenging as some things might be now versus 10 years ago. There are many, many novel ways that we can reach people, and I think we should definitely continue to leverage that.
Mm-hmm. I agree. All right.
Oh, hello. You have some last words?
Yeah, for our final question.
1 second.
Oh my goodness, you're so cute.
All right. So HPV is a preventable infection, but with serious consequences if left unchecked. If you could share one piece of key advice with women regarding HPV prevention and early detection, what would it be?
Get vaccinated, get screened.
Simple.
Simple. You agree? Yeah.
All right. Well, thank you so much, Dr. Leung, for your insights and for joining us today. Your work is truly inspiring, and we're grateful for the important strides that you've made in cervical cancer prevention and care. And to our viewers, thank you so much for listening, and don't forget to follow our Instagram and our Facebook at wham.initiative to stay up to date with more exciting events and campaigns. Thank you.
Thank you. What do you want to say?
Oh, he was looking.
What do you want to say?
Go get screened.
Yay! Bye!
You were the best podcast host.
Yeah,
Right
you
after
were.
your mommy.
Oh, you're so sweet. No, you steal the show every time. Yeah? Are you a big boy?
Oh, you're so cute. Thank you. That was great. I think that was a really great discussion.